Hello everyone. Next chapter, second chapter is sulfonamides or sulfa drugs. Now, as we discussed earlier, Paul Ehrlich was the scientist who come up with selective staining of microorganisms, and he suggested some dyes which kill the bacteria. Okay, and later it is observed that this first statement we discussed various antiseptics and disinfectants. Okay, now in the second chapter it is observed that later that sulfomoyl group, that is SO2NH2, has affinity for protein molecule. This lead to synthesis of azo dyes containing SO2NH2, that is sulfomoyl group containing azo dyes. Why? Because this SO2NH2 group is responsible for or has affinity for protein molecule. Okay, so these drugs will be absorbed in bacteria and they will be responsible for killing the bacteria. So this was the intention behind synthesis of azo dyes containing SO2NH2. Now on this, Prontosil was the first drug. Okay, now this was an azo dye, but this antibacterial activity associated with Prontosil is not because of azo dye, but because of presence of para-aminobenzene sulfonamide, okay, which is obtained by its reductive cleavage in the gut. After its consumption, this is converted into para-aminobenzene sulfonamide, which is obtained by reduction. Okay, Prontosil is a prodrug and it is active in vivo but not in vitro. Now this is a new term for D-pharmacy students, prodrug. What are prodrugs? Prodrugs are inactive molecules which after consumption, okay, when we take these drugs, they are metabolically converted into active compounds. Such compounds or such drugs are called as prodrugs. Prontosil is inactive in vitro. In vitro means outside the body. Okay, Prontosil is inactive, but when we consume it, when it enters your system, it is converted or it is reduced to an active compound. That's why Prontosil is a prodrug. Okay. Now, later it is observed that small changes in sulphanilamide. Now, sulphanilamides mean para-aminobenzene sulfonamide is sulphanilamide. Okay, so if we bring small changes on this benzene ring substitution, okay, it reduces the activity. This was the observation. Okay, now this is the structure of Prontosil which we are talking about. Now this is the azo linkage. Okay, this is this is amino group, so this is para-aminobenzene sulfonamide. Okay, so when this drug enters systematically, the reduction will take place at this place. This group, it is it is separate, and this NH2 group will be separate. Okay, so it will give you para-aminobenzene sulfonamide. That's why it is a prodrug. Now, these sulfa drugs or sulfonamides, they are classified, there are various classifications. First is on the basis of their therapeutic use. Okay, therapeutic use, synthetic antibacterial sulfonamide. This is the first class, and non-antibacterial sulfonamides. Some compounds, they are used as antibacterial agent. The others, they have different uses, different therapeutic uses. So non-antibacterial sulfonamides are diuretic sulfonamides, hypoglycemic agents like tolbutamide. Okay, so this is on the basis of their chemotherapeutic use. On the basis of synthetic antibacterial sulfonamide, now this is a groupism, groups. Okay, Compounds containing sulphanilamide, that is aniline substituted derivatives. Okay, aniline substituted derivatives. Sulphadiazine, Sulphaguanidine. Second, prodrugs, which are inactive in vitro, active in vivo. That is, example is sulfasalazine. And last drug, the third class, that is non-anilides. Mephenide. Obviously, we are not discussing this mephenide under this chapter because it is a non-anilide derivative. Chemical classification. This is important. N1 substituted sulfonamide. Okay, the nitrogen which is attached to SO2 group is called as N1. Okay, N1 substituted sulfonamide. Now, this substitution can be an acyl substitution, okay, or this can be an heterocyclic substitution like sulphadiazine or various other sulphamethoxazole, sulphamethoxyzine. Okay. Second class is N4 substituted sulfonamides, where the substitution is on the para-amino group, that is called as N4 nitrogen. Example is sulphasalazine. Okay, that means all the prodrugs, they come under the second class, N4 substituted sulfonamides. And the last class, that is both the nitrogens if they are substituted, N1 and N4. Example is Phthalylsulphathiazole. Okay, so this is based on chemical classification or chemical structure. On the basis of absorption, okay, this classification is like this. On the basis of absorption, sulfonamides which are poorly absorbed orally and used for intestinal infection. So they will show local action but in the intestines. Second class, absorbable compound for systemic use. After oral consumption, they are absorbed. Okay, on the basis of T-half, time required for elimination of 50% of drug, absorbed drug, that is called as T-half. Okay, so on the basis of duration of action, they are short acting, medium acting, long acting and ultra long acting. Okay, short acting, medium, long, ultra long. Okay, depending on their therapeutic action. For urinary tract infection, sulphamethoxazole, drugs like sulphacetamide. For respiratory tract infection, Cotrimaxazole. For meningeal infection, Sulphadiazine. For intestinal infection, Sulphaguanidine and Phthalylsulphathiazole. For ophthalmic infections, Sulphacetamide. And for burn therapy, mephenide and silver sulphadiazine. Okay, so this is on the basis of therapeutic action. Now, chemistry and nomenclature. How these drugs, sulfa drugs, they are given names. Okay, now this is we are talking about the general nomenclature. Okay, generic name you can say. The N-substituted derivative of sulphanilamide are called as sulfa drugs. Okay, one hydrogen of sulfoamyl group is placed by various substituents. Now, look at this. As I said, the group which is attached to sulfoxide, SO2 group, that is N1 nitrogen. The group which is attached to N4, the other amine group, that is called as N4 nitrogen. Okay, now as far as the sulfa drugs they are concerned, the pKa value plays an important role. Okay, before nomenclature we'll discuss this part, just because we have drawn the reaction. Okay, so just hold a minute for nomenclature. First of all, discuss the pKa. What is the importance of pKa in this particular class? Now, when we consume these drugs, sulfonamides, okay, these drugs, they produce crystal urea. The major side effect associated with this drug is crystal urea. Okay, what is crystal urea? That means you will find this sulfonamide, it is not excreted from kidneys through urine, but it is present as a salt form. So it forms crystals. Okay. Now this can be painful for patients consuming these drugs. Now to avoid this crystal urea formation, or why these drugs they produce crystal urea, the answer lies regarding or based on their pKa value. Okay, so pKa value of generally all the sulfonamide which are not substituted, okay, their pKa value is around 10.4. That means 10.4 value, half of the drug will be in ionized form and half of the drug will be in unionized form. Okay, now this is the reason. And if the drug is excreted through urine has a pH around 5 to 6. So to this pH, this drug or the sulfa drugs, they are unionized, and that's why they are responsible. I mean, there is formation of crystal urea. To overcome this issue associated with these drugs, the N1 nitrogen is substituted with some group, alkyl groups or acyl groups or any other group. Okay, now this changes their pKa value. Okay, and many of these substituted compounds which are used for various therapeutic uses, they do not have this crystal urea problem, just because their pKa value is around the 5 to 6. That's why they are easily excreted through urine. Okay. Now, how to give generic name to sulfa drugs? This is our question. This is what we are discussing. Simple rules: add prefix sulfa to the abbreviated chemical name of N1 substituent. Whichever group is present at N1 position, add prefix sulfa. That will be the generic name of that sulfa drug. Okay, if it is only N1 substituted. If the drug is only N4 substituted, then N4 substituent is prefixed with or prefixed to sulfa. The sulfa will come after that substituent. Okay, so if I say succinyl sulphathiazole is a name of a drug, succinyl sulphathiazole. Okay, succinyl group is present at N4 position because it is prefixed to sulfa. Okay, and thiazole ring is present at N1 position. Okay, this is how we can come up with general name of any sulfonamide or any sulfa drug by this using these two rules. Okay. Physical properties. Now we are generally calling or enlisting all the physical properties of sulfa drugs which are used therapeutically. Okay, they are white or crystalline, yellowish crystalline powder, odorless, very slightly soluble in water, okay, soluble in alkali hydroxide and dilute mineral acid. Test, there are various tests. Some are testless, some are acidic or saline, some are bitter and some are slightly bitter. Okay, they are affected by heat. They are affected by heat, light and moisture. Hence they are stored in tightly closed containers. Okay. Now the first drug, Sulphadiazine. This is its structure. At N1 position you have pyrimidine ring. Okay, so the IUPAC nomenclature will be N1 pyrimidine 2-vial. Now this 2 is for the position where this NH group is attached to this pyrimidine ring. Okay, so it is a second position. So this is N1 pyrimidine 2-vial sulfonamide. This is the most simple IUPAC or chemical name of this structure. Or you can go for the second IUPAC nomenclature where we can consider pyrimidine ring as a parent structure and the rest of the part will be a substituent. So it will be 2 is the position where substitution is attached to this pyrimidine ring, 2 in bracket para-aminobenzene sulfonamidopyrimidine. You can follow any one. Now, chemical properties, because we have just enlisted all the physical properties of all sulfonamides. Chemical property, one of the most important chemical property of sulfadiazine is diazotization. It reacts with sodium nitrate in hydrochloric acid or acetic acid at 0 degrees Celsius, which produces a diazole or diazonium compound. Okay, and this is a colorful one. Okay, so this diazotization reaction is given by sulfadiazine just because it has free amino group at para position. At N4 we have a free amino group, so it gives diazotization reaction. Second important chemical property of sulfadiazine, that when it is dissolved in 0.1 normal sodium hydroxide solution and 1% copper sulfate solution is added, purple brown color precipitate is obtained. Okay, so this second chemical property is similar to all drugs, only the change is this color. Okay, for sulfadiazine it is purple brown color or purple brown precipitate. Uses, it has antibacterial activity, so it is used in meningitis, urinary tract infection, toxoplasmosis in combination with pyrimethenamine. It's a silver salt, silver sulfadiazine is used topically in treatment of burns. So we have sulfadiazine tablets, sulfadiazine injection, trisulfapyrimidine tablet. Okay, so these are some pharmaceutical preparations available of this sulfadiazine. Second drug, which is Sulphaguanidine. Okay, now simply the IUPAC nomenclature will be, okay, now this is, remember, this entire thing is guanidino group. Okay, carbon double bonded NH, NH and NH2. This is guanidine. Okay, sorry, this is guanine. Okay, so to this guanine we have this para-aminobenzene sulfonyl group attached. So first nomenclature will be by considering this guanine as parent structure and this one as a substitution. So it will be N in bracket para-aminobenzene sulfonyl, this para-aminobenzene sulfonyl guanine monohydrate, because water molecule is there which is responsible for, or which is called as water for crystallization. Second IUPAC nomenclature will be N1 amidino. Now this one is amidino, carbon with 2 nitrogen, one of them is double bonded. Okay, so N1 amidino sulfanilamide monohydrate. You can follow any nomenclature for this sulphaguanidine. Again, this will give diazotization reaction just because the para-amino group is free, so it will give, or it will form a diazo salt. Secondly, it will also give, second property is it dissolves, that is reaction with reaction of 1% copper sulfate solution, it gives blue color. This is its second chemical property. Uses, it is antibacterial and poorly absorbed through gastrointestinal wall. So it is used for local intestinal infections such as bacillary infection. The important preparation of this drug is Introgen. It's a generic name. Okay, this tablet is used for dysentery and diarrhea. Third drug coming under this class from your syllabus is Phthalylsulphathiazole, and this is its structure. Now in this case, both N1 and N4 nitrogens, they are substituted. Okay, so the IUPAC nomenclature will be 2 in bracket 4 in bracket 1,3-thiazole, 2-vial amino bracket close sulphonyl bracket close phenyl bracket close amino bracket close carbonyl bracket close benzoic acid. So this part is your parent structure, and remaining everything as we have considered as a substitution. Now this drug, as the N4 nitrogen is substituted, it will not give you diazotization reaction. Okay, so as far as its chemical property is concerned, this does not give diazotization reaction. Now what are the substitutions present in this structure? At N1 position we have thiazolyl group. This is thiazole, so thiazolyl group. And at N4 we have phthalyle group. This is phthalyle, a derivative of phthalic acid. Okay, or it's a phthalic acid, but after reaction with this drug there is loss of water molecule. So hydroxyl group is lost from this carboxylic acid group. So it is called as phthalyle. N1 substituent increases antibacterial activity. This thiazolyl group increases antibacterial activity. N4 substituents prevent its gastrointestinal absorption. That means it is only used for local action inside the intestine. Okay, this drug is slowly hydrolyzed in intestine, and hence it is useful for local intestinal infection. It is preferred to sulphaguanidine, which we have previously discussed, as antibacterial in ulcerative colitis. Okay, whenever there is an abrasion, rupture of internal walls of stomach or intestine, okay, that is called as ulcerative colitis. So there are chances that this drug, any drug sulfonamide which we are administering, that can enter or penetrate the systemic circulation. Okay, so sulphaguanidine cannot be administered in ulcerative colitis. So in ulcerative colitis, a larger group is administered, or larger molecule is administered, that is Phthalylsulphathiazole, which will not be absorbed from gastrointestinal tract. Properties. Now this drug has different properties. Now first property is that it does not give diazotization reaction, just because NH2 group is not free, N4 nitrogen is not free, it is substituted, so it will not give diazotization reaction. Second, Phthalylsulphathiazole is dissolved in 0.1 normal NaOH and 1% copper sulfate solution is added, it gives green color. When Phthalylsulphathiazole is heated for 1 minute, this is third property. Third, it is heated for 1 minute with resorcinol and concentrated sulfuric acid. Then the mixture is poured in aqueous sodium hydroxide solution. Green fluorescence is produced, which disappears when solution is acidified. This is again the third chemical property, or you can say rather identification test for Phthalylsulphathiazole. Okay. Uses: it is antibacterial and not absorbed through GIT. So it is used in treatment of bacterial dysentery. It will show only local action to reduce bacterial flora of large intestine before surgery. So it will have another one use. Okay. Fourth drug from this class is Sulphadimethoxine. Sulphadimethoxine. Sorry for the pronunciation. So in this case, N1 position is replaced by 2,6-dimethoxypyrimidine. Okay, heterocycle. Now this is the structure. This is 2,6-dimethoxypyrimidine, and this pyrimidine ring is attached to this nitrogen at 4th position. So this 4-vial. Okay, so 4 amino, N in bracket, 2,6-dimethoxypyrimidine 4-vial benzene sulfonamide, because substitution is only at N1 position. Chemical property, due to presence of, as I said earlier, due to presence of this free amino group, now this can give diazotization reaction. And second one, the sodium hydroxide solution of this drug, when mixed with 1% copper sulfate solution, it gives yellowish green color or yellowish green precipitate. This is second chemical property. Use, it is long acting antibacterial agent used in urinary tract infection. Sulphadimethoxine. Fifth drug, Sulphamethoxypyridazine. Okay. Now, only one substitution at N1 nitrogen, that is of 6-methoxypyridazine. This is pyridazine ring. 2 nitrogens they are placed on iso position 6-membered ring. So the IUPAC name will be 4-amino N1 in bracket or N in bracket 6-methoxypyridazine 3-vial 1, 2, 3. 3-vial bracket close benzene sulfonamide. Okay. Yes, we have discussed this. Chemical properties, yes, again N4 nitrogen is free, so it will give diazotization reaction, and its sodium hydroxide solution when reacted with copper sulfate solution, it gives greenish brown color. Every drug gives different color with this copper sulfate solution. Use, it is long acting antibacterial agent used in urinary tract infection. Next drug, Cotrimaxazole. Now this is important drug. Cotrimaxazole is not a single drug, but it is a mixture of 2 drugs. It is a mixture of 5 parts of sulphamethoxazole and 1 part of trimethoprim. Now this trimethoprim is anti-malarial drug. So it's a combination of these 2. Remember the parts. Okay. This sulphamethoxazole is 5 part. 1 part is trimethoprim. Sulphamethoxazole is sulphanilamide, in which N1 substitute, it is N1 position, we have 5-methyl isoxazole ring. Okay. And this presence of this heterocyclic ring improves its antibacterial activity, and its pK value is 5.6. That means it does not produce crystal urea. It is white crystalline powder, odorless, and has a bitter taste. It is slightly water soluble. We are talking about sulphamethoxazole. Okay. Now look at the structures of these 2 drugs. This is sulphamethoxazole. Okay. 4-amino, this N in bracket 5-methyl isoxazole, isoxazole, 3-vial 1, 2, 3. At 3rd position it is attached to this nitrogen, so 3-vial benzene sulfonamide, that is sulphamethoxazole. Trimethoprim, well, this is a completely different drug. Okay, as it is an anti-malarial. 5 in bracket 3,4,5 trimethoxybenzyl. Okay, this is 1, 2, 3, 4, 5. 5th position we have this entire substitution 3,4,5 trimethoxybenzyl pyrimidine 2,4-diamine, that is trimethoprim. Now this is in short about trimethoprim. We have seen it is a 3,4,5 trimethoxybenzoyl group at C5 position. Presence of methoxy group in phenyl nucleus reduces lipophilicity. So we are talking about this trimethoprim, and thus optimum activity is obtained. It is not only anti-malarial but also antibacterial. That's why it is combined with sulfa drug. It is a white to yellowish powder, odorless, has bitter taste, slightly soluble in water. Okay. Now, when sulfamethoxazole is given alone, what is happening? Just now, why this combination? Okay, when sulfamethoxazole is given, resistance is developed. It also produces toxic effect like crystalluria when it is given alone. I am talking. Trimethoprim also produces resistance when it is given alone. That's why we are combining these two drugs to get synergistic effect. Okay, synergistic effect means they promote each other's effect or they support each other's mechanism of action. Okay, combination of these two drugs are administered. Spectrum of antibacterial activity increases due to synergistic action by inhibition of both. Now you have to remember these two enzymes. These enzymes are inhibited by these two drugs, combination of these two drugs, dihydrofolate synthetase and dihydrofolate reductase. So when we give these drugs in combination, resistance is not developed easily. Okay, that's why we are giving this cotrimoxazole combination. Uses: gastrourinary tract infection, respiratory tract infection like bronchitis, pneumonia, meningitis, enteric infections like typhoid and paratyphoid. Preparations: now it is available as tablet, injection, dispersible tablet, pediatric tablet as well as pediatric mixture. Next drug is sulphacetamide. Now simple drug. Acetamide group is attached to N1 position of sulfonamide. Okay, acetyl group. Chemical properties: due to presence of free amino group, it gives diazotization reaction. Now color reaction with 1% copper sulfate solution gives blue colored precipitate. Okay. Uses: it is antibacterial, hence used as locally to treat eye infection and systematically to treat urinary tract infections. Preparation: sulphacetamide eye drops and sulphacetamide ointment. That's all.